What if the symptoms you keep blaming on age are actually your body asking for help? The tiredness, the aching joints, the brain fog, the strange low fever that comes and goes, the digestion changes you keep blaming on food, stress, or hormones. At first, they seem small. You still go to work. You still take care of everyone. You still tell yourself, "I'm fine." But some days, even simple things feel heavy. And because the symptoms are not dramatic, you ignore them. It's hormones. It's age. I just need more sleep. But autoimmune problems do not always begin with one obvious sign. Sometimes, they begin quietly through patterns your body repeats again and again, hoping you will finally notice. Today, we'll talk about 9 early signs of autoimmune problems people often ignore, especially women over 40. Not to scare you, not to diagnose you, but to help you pay attention before your body has to speak louder. This video is for educational purposes only and is not medical advice. It cannot diagnose, treat, or cure any condition. If your symptoms are persistent, worsening, or affecting your daily life, please speak with a qualified healthcare professional. Sign number 1. Deep fatigue that does not feel normal. Everyone gets tired. But this kind of fatigue can feel different. You may wake up exhausted, even after sleeping. Small tasks may feel heavier than they should. You may look fine on the outside, but inside, it feels like your body has no battery. This is not laziness. Sometimes, when the immune system is highly active or inflammation is present, the body may use more energy in the background. The key question is this fatigue new? Is it lasting? Is it changing how you live? If yes, it may be worth tracking. Sign number 2. Recurring low-grade fever. Not a sudden high fever from a clear cold or flu, but a mild temperature that keeps appearing, often with fatigue, chills, body aches, or the feeling that your body is fighting something. Fever is usually linked to infection, and infection should always be considered first. But in some autoimmune conditions, the immune system can become activated even when there is no obvious outside invader. Think of fever as part of the body's alarm system. It does not tell you the exact cause. It only tells you that something deserves attention. If fever keeps returning, or comes with night sweats, unexplained weight loss, severe weakness, or worsening symptoms, speak with a healthcare professional. Sign number 3. Joint pain, stiffness, or swelling that comes and goes. Your fingers may feel stiff in the morning. Your knees may ache without a clear injury. Your wrists or shoulders may hurt for a few days, then calm down again. That on and off pattern makes you dismiss it. You blame age. You blame weather. You blame yesterday's walk. Sometimes, those explanations are correct. But if stiffness keeps returning, swelling appears, both sides of the body are affected, or mornings are especially difficult, that pattern matters. It may not be a full alarm yet, but it is still a signal. Sign number 4. Brain fog. You forget words. You lose your train of thought. You read the same sentence again and again. You feel like your mind is moving through thick glass. Brain fog can come from stress, sleep problems, blood sugar changes, menopause, anxiety, medication effects, or nutrient deficiencies. But when it appears together with fatigue, fever, joint pain, skin changes, or digestive changes, it may be part of a bigger pattern. This does not mean you should panic. It means you should pay attention, because your brain is not separate from your body. When your body is inflamed, stressed, or out of balance, mental clarity can suffer too. Sign number 5. Recurring digestive changes. This may include ongoing diarrhea, constipation, loose stools, nausea, food reactions, unexplained weight changes, or bowel habits that are different from your normal pattern. Your gut is not just where food is broken down. It is also one of your body's most important immune borders. Every day, your immune system has to make careful decisions inside the gut. It must tolerate food. It must live alongside helpful microbes. And it must still be ready to respond to harmful invaders. Sign number 6. Skin changes. Your skin is often where internal imbalance becomes visible. You may notice rashes that come and go. You may experience dry patches, redness, itching, unusual sensitivity, or reactions after stress, illness, certain foods, or sun exposure. Skin symptoms are easy to treat as only a surface problem. You change soap, you buy a cream, you cover it up, and sometimes that helps. But if skin changes keep returning, spreading, becoming painful, or appearing with other symptoms, it may be time to look deeper. Sign number 7. Strange body sensations. This can include tingling, numbness, burning feelings, unusually cold hands or feet, or pins and needles without a clear reason. You may also notice that your fingers react strongly to cold or stress. These symptoms can have many causes, including circulation problems, nerve irritation, vitamin deficiencies, thyroid issues, diabetes, stress, and other conditions. But when these sensations keep returning, feel unusual for you, or appear with fatigue, joint pain, fever, skin changes, or brain fog, they deserve attention. Do not guess. Track what happened, when it happened, how long it lasted, and what came with it. Doctors can work better with patterns than vague memories. Sign number 8. Persistent or recurrent hiccups. This one is less common, and it is not a classic early sign for most autoimmune problems. Most hiccups are harmless and go away quickly, but hiccups become more important when they last unusually long, keep coming back, disturb your sleep, affect eating, or appear with other symptoms. Why could this matter? Hiccups happen when the diaphragm and the nerves that control breathing rhythm become irritated. In rare situations, inflammation affecting the nervous system, the brainstem, the chest, the esophagus, the stomach, or nearby structures may contribute. Some autoimmune or inflammatory conditions can involve these areas, but many non-autoimmune causes are also possible. So the message is not, hiccups mean autoimmune disease. That would be wrong. The message is, if your hiccups are persistent, recurrent, unusual for you, or combined with fever, weakness, numbness, trouble swallowing, severe headache, chest pain, shortness of breath, vomiting, or unexplained weight loss, do not dismiss them. Speak with a healthcare professional. A strange symptom is not always dangerous, but a strange symptom that keeps returning is worth investigating. Sign number 9. Symptoms that flare in patterns. This is not about one single symptom. It is about timing. You may notice that after a stressful week, your fatigue feels heavier. After poor sleep, your joints feel stiffer. After an infection, your energy does not bounce back. After certain repeated situations, your skin, digestion, brain fog, fever, or body aches seem to change. This does not mean stress, food, or poor sleep caused an autoimmune disease. That would be too simple. But your immune system is deeply connected to the rest of your body. Sleep, stress, infections, hormones, physical strain, and the gut environment can all influence immune activity. So instead of guessing, track patterns. Track the symptom: fatigue, brain fog, fever, joint stiffness, skin changes, digestive changes, tingling, pain, or hiccups. Track severity. Use a simple 0 to 10 scale. Track timing: morning, afternoon, evening, after meals, after poor sleep, after stress, after exercise, after illness, or around hormonal changes. Track duration. And if food seems involved, track repeated patterns. Not one random meal. One bad day proves nothing. The same pattern repeating is useful information. So, what should you do if several of these signs sound familiar? First, do not panic. These symptoms do not automatically mean you have an autoimmune disease. They are common symptoms, and they can come from many different causes. Second, do not dismiss your body just because the symptoms are invisible. You do not need to wait until you completely break down before asking for help. Third, bring clearer information to your doctor. Not just, I feel bad, but when did it start? How often does it happen? How severe is it? What comes with it? What seems to make it better or worse? The goal is not to label yourself. The goal is to understand your body earlier. Your body is not your enemy. Even in autoimmune disease, your immune system is not evil. It is a protection system that may be confused, overactive, or misdirected. And the more you understand it, the less frightening it becomes. If this video helped you understand your body a little better, subscribe to the channel and turn on notifications. And if you know someone who keeps saying, I'm just tired, but you can see they are not feeling like themselves, share this video with them. Sometimes, one clear explanation can help someone stop ignoring a signal their body has been sending for a long time. Thank you for watching.